So, parainfluenza viruses. These viruses are ubiquitous or all over the place, no? And they cause common respiratory illnesses across all ages. But they are the major pathogens of severe respiratory tract infections in infants and young children, according to the National Center for Biotechnology Information, or NCBI, or the National Institutes of Health. These are the second most common cause of acute respiratory illness, leading to hospitalization in children under 5 years old. There are four types, no? 1 through 4. So HPIV 1 and 2 are most often associated with croup. HPIV 1 often causes croup in children, whereas type 2 is less frequently detected, but both types can cause upper and lower respiratory tract illnesses. People with upper respiratory tract illness may have cold like symptoms only. Type 3 is more often associated with bronchiolitis, bronchitis, and pneumonia. Type 4 is not recognized as often, but they may cause mild to severe respiratory tract illnesses. Parainfluenza viruses usually spread by direct contact with infectious droplets or by airborne spread when an infected person breathes, coughs, or sneezes. Okay? They may remain infectious in airborne droplets for over an hour and on surfaces for a few hours depending on environmental conditions. People are most contagious during the early stage of illness. Okay, incubation period is about 5 to 6 days, and viral shedding can start several days before or prior to the onset of symptoms until about 1 week after the onset of illness. Although this can be prolonged in those with compromised immune functions, no? And especially in adults with chronic lung disease. But in the immunocompetent host, the involvement is usually limited only to the respiratory epithelium or the respiratory tract. No? The infection may involve only the nose and the throat, resulting in a common cold lung. But one of the most important illnesses caused by the parainfluenza viruses is when it involves the larynx and upper trachea, causing croup or the laryngotracheobronchitis. Although many pediatricians would rather call it laryngotracheitis only, no, usually caused by the types 1 and 2, uh, because they want to reserve the laryngotracheobronchitis for more extensive disease, no, when the infection spreads deeper to include the lower trachea and the bronchi, and even to the bronchioles and lungs to cause bronchiolitis and pneumonia. This again, like I said previously, like I mentioned earlier, bronchiolitis and pneumonia usually are caused by type 3 parainfluenza viruses. So remember, like the croup produced by influenza, this presents with stridor and a barking cough also due to the narrowed upper airways. It usually affects children 6 to 18 months old. The bronchiolitis and pneumonia are common in infants under 6 months old. Okay? The most common complication of parainfluenza virus infection is otitis media or infection of the middle ear. Reinfections are common, by the way, throughout childhood and even in adults, although it is milder na by then because of the presence of antibodies elicited by earlier infections. So actually, despite having protection against reinfection in the form of secretory IgA antibodies, these antibodies disappear within a few months. So that's why reinfection can happen. And because infections are usually mild and self-limited, of course, unless in high-risk patients, no, laboratory diagnosis is not that important. Croup or laryngotracheobronchitis, however, can be clinically diagnosed considering the characteristic inspiratory stridor, hoarseness, and the barking cough. You can take an x ray and you will see the tapering of the upper trachea on a frontal chest x ray, which looks like a steeple of a church. So that's why it's called the steeple sign. Management of human parainfluenza virus infection includes isolation of infected patients. Treatment with medications is usually supportive, no, to address the symptoms only, since it usually resolves spontaneously. The antiviral ribavirin can be used in immunocompromised patients with lower respiratory tract disease. Prevention is primarily by isolation or staying away from infected patients. And of course, careful hand washing. Actually, vaccines are also still being developed for parainfluenza virus.